Good morning, Lars Medical Group. Sam speaking.
It's very intense, it never
How may I
stops.
help?
I think it's a perfect storm.
It's just going to start to deteriorate.
They're talking about a fragile front line in healthcare. Staff in GP practices who fear surgeries, the first port of call for many of us, are on their last legs.
And what's your name and date of birth?
They'd run out of appointments by 9 a.m. at this practice in Largs. Sam's had to say no to some, and it's a pressure she struggled with.
It does have an impact, and I have suffered from burnout and had to take time out because of the stress. People can say some very nasty things. Well, if you're not giving me an appointment today, if my father dies, it's on you.
Really?
Yeah, that's been said to us.
Seeing a GP harder because they've been unable to fill a vacancy for a doctor here. It's a challenge across the country and means work piles on others, pushing them to their limit.
I'm going to be honest with you here. 6 months ago, I could have quite happily walked out that door and not come back.
Really?
Yeah, genuinely. Feeling just completely burnt out with the whole thing.
Looking at retention problems, looking at recruitment problems, looking at the burnout that GPs are facing right now in this country, is that a crisis for GPs?
I would say so.
Talking to the staff here, it's clear that they know the importance of the job they do in this community, but that they are under so much pressure, they have very little left in the tank to give. GPs would call this a crisis right now. How does it feel that that has taken place under your watch as Health Secretary?
Well, look, you can make this personal if you wish, but there's no...
That's what they would say, that it is a crisis, and it has happened under you as Health Secretary.
I would say that, of course, the pandemic has impacted...
That is a part of it, yes.
Well, it's not a part of it. It's the biggest shock that the NHS has ever faced in its 74-year existence. Now, if it was happening just in Scotland, I think you'd be absolutely right to say, well, this is an SNP problem or a Hamza Yusuf problem.
But you are Health Secretary here, so it is on what you're doing here.
And that's why I've given you pretty detailed answers and responses to what we're doing. Increasing general practice GPs, increasing multidisciplinary staff, making sure we're investing in primary care as we're currently looking to do.
But a leader of Scotland's doctors says a government plan for 800 more GPs by 2027 is nowhere near enough. Thousands are needed.
Their own workforce survey showed that we've got 3% less doctors, whole-time equivalent, than we did 3 years ago. So we're actually going backwards. If general practice fails, then the whole system will collapse. And I am seriously worried that is what's happening.
A worrying warning of a service stretched to breaking point, pressure piled on primary health care, the people who run it and the patients who need it. Alan Jenkins, 5 News.